What is cancer? What causes cancer? Cancer treatment options. Cancer is a group of diseases characterized by the uncontrolled growth and spread of abnormal cells in the body. These abnormal cells form a mass of tissue called a tumor, which can be either benign, non-cancerous, or malignant, cancerous. Malignant tumors have the potential to invade nearby tissues and organs, as well as spread to other parts of the body through the bloodstream or lymphatic system, a process known as metastasis. Causes of cancer. Cancer is a complex disease, and its development is often influenced by a combination of factors. While the exact cause of cancer can vary depending on the type, some common risk factors include genetic, environmental, lifestyle, age, chronic inflammation factors. Let's explore each of these in more detail. 1. Genetic factors. Genetic mutations play a significant role in the development of certain cancers. These mutations can be inherited from parents or may occur during a person's lifetime due to various factors like exposure to radiation, certain chemicals, or errors during cell division. Inherited genetic mutations, such as BRCA1 and BRCA2 gene mutations, are associated with an increased risk of breast and ovarian cancer, while mutations in the APC gene are linked to an elevated risk of colorectal cancer. It's essential to recognize the presence of these genetic mutations, as they can help identify individuals at a higher risk of developing specific types of cancer and inform early screening and prevention strategies. 2. Environmental factors. Exposure to various environmental agents and carcinogens can contribute to cancer development. Some of these include tobacco smoke. Smoking or exposure to secondhand smoke is a major risk factor for various cancers, including lung, throat, mouth, esophageal, bladder, and pancreatic cancer. Ultraviolet, UV, radiation. Prolonged exposure to UV radiation from the sun or artificial sources, example, tanning beds, can lead to skin cancer, including melanoma and non-melanoma skin cancers. Ionizing radiation. High levels of ionizing radiation, such as that used in certain medical treatments or experienced during nuclear accidents, can increase cancer risk. Chemical carcinogens. Exposure to certain chemicals found in the workplace, like asbestos, benzene, and formaldehyde, can increase the risk of developing lung, bladder, and other types of cancer. Air and water pollutants. Prolonged exposure to pollutants in the air and water may contribute to cancer development, although the specific links can be complex and require further study. 3. Lifestyle factors. Several lifestyle choices and behaviors can significantly impact cancer risk. Unhealthy diet. Diets high in processed foods, red and processed meats, unhealthy fats, and low in fruits and vegetables are associated with an increased risk of various cancers. Lack of physical activity. Sedentary lifestyles can contribute to obesity and increase the risk of developing several cancers, including breast, colon, and endometrial cancers. Alcohol consumption. Regular and excessive alcohol consumption is linked to an increased risk of developing certain cancers, such as those affecting the liver, mouth, throat, esophagus, and breast. Tobacco and substance use. Tobacco use in any form, cigarettes, cigars, smokeless tobacco, is a significant risk factor for numerous cancers, including lung, mouth, throat, and esophageal cancer. 4. Age and hormonal factors. As people age, the risk of developing cancer increases. This is partly due to accumulated genetic mutations over time and a reduced ability of the body's immune system to detect and eliminate abnormal cells. Additionally, certain cancers, such as breast and prostate cancer, can be influenced by hormones, and changes in hormone levels with age may play a role in their development. It's important to emphasize that not all cancers are preventable, as some cases may arise spontaneously or due to a combination of unknown factors. However, adopting a healthy lifestyle, avoiding known carcinogens, and getting regular screenings for early detection can significantly reduce the risk of developing certain types of cancer and improve overall health outcomes. Moreover, ongoing research and advancements in cancer prevention, early detection, and treatment continue to contribute to improved outcomes for individuals affected by cancer. Treatment of cancer. Cancer treatment depends on several factors, including the type and stage of cancer, the patient's overall health, and their preferences. Some common treatment options include 1. Immunotherapy. Immunotherapy is a groundbreaking treatment that harnesses the body's immune system to fight cancer. It involves the use of drugs that either enhance the immune response or remove the brakes that cancer cells often exploit to evade detection. These therapies can help the immune system recognize cancer cells as foreign and attack them. Immunotherapies have shown remarkable success in certain types of cancer, such as melanoma, lung cancer, kidney cancer, and some forms of lymphoma. 2. Targeted therapy. Targeted therapies are drugs designed to specifically target certain molecules or proteins that are involved in the growth and survival of cancer cells. By focusing on these specific targets, targeted therapies can disrupt cancer cell signaling and inhibit their growth. Unlike chemotherapy, which can affect both cancer and normal cells, targeted therapies aim to minimize damage to healthy cells, reducing side effects. Targeted therapies have been successful in treating various cancers, including breast cancer, colorectal cancer, and certain types of leukemia. 3. Precision medicine. Precision medicine, also known as personalized medicine, involves tailoring cancer treatment based on the individual characteristics of the patient and their tumor. This approach considers the specific genetic makeup of the tumor and, in some cases, the patient's genetic profile, to identify the most effective treatment. Molecular profiling of tumors helps oncologists select therapies that have a higher chance of success while minimizing the risk of ineffective treatments. 4. Hormone therapy. Hormone therapy is commonly used to treat cancers that are hormone sensitive, such as breast and prostate cancer. This approach involves blocking hormone receptors or reducing hormone production to slow down or halt the growth of hormone-driven tumors. 5. Radiation therapy. Radiation therapy uses high-energy rays or particles to target and destroy cancer cells. It is often used in conjunction with other treatments, such as surgery and chemotherapy, to shrink tumors before surgical removal or to eradicate remaining cancer cells after surgery. Radiation therapy can be delivered externally, external beam radiation, or internally, brachytherapy, depending on the type and location of the cancer. 6. Chemotherapy. Chemotherapy uses drugs to kill rapidly dividing cancer cells or to prevent them from growing and dividing. While chemotherapy can also affect normal cells that divide rapidly, such as hair follicles and cells in the digestive tract, it remains a crucial treatment for various cancers. Newer chemotherapy agents are being developed to be more selective for cancer cells and have fewer side effects. 7. Surgery. Surgery is one of the primary treatments for localized cancers, where the tumor is confined to a specific area. Surgical removal of the tumor and nearby affected tissues can often lead to a cure or significantly extend the patient's life. In some cases, surgery may be combined with other treatments like chemotherapy or radiation therapy to improve outcomes. 8. Bone marrow transplant and stem cell therapy. For certain blood cancers, such as leukemia and lymphoma, a bone marrow transplant or stem cell transplant may be necessary. These procedures involve replacing diseased or damaged bone marrow with healthy stem cells, either from the patient, autologous transplant, or a matched donor, allogeneic transplant. It's important to note that cancer treatment is often tailored to each patient's specific needs, and combinations of treatments are frequently used to achieve the best possible outcomes. Additionally, supportive care, including pain management, psychological support, and addressing side effects, is a crucial aspect of cancer treatment to improve the patient's quality of life during and after treatment. As research continues, new and innovative therapies are being developed, offering hope for improved cancer treatments and better survival rates in the future.